Assalamualaikum and good evening guys. It's about 11 now. So as promised, we're going to record this lecture 3 in videos in YouTube, so you can watch anytime. Okay, what we're going to talk about today is about the history of vitamins. There are so many vitamins, so I'm just going to talk about 3. The first being discovered vitamin A, B1 and C. In the chronological order. This is the reference where I got it from. Okay, the first question I ask you is whether you have ever cycled in the dark. Well, I do not know about you, but when I was say 9 years old, 10 years old, yes, I was able to cycle in the dark. Those days we have not enough street light, so the road was really dark, but I was able to cycle. I had the night vision. I can see in the dark. Question number 2. Can chicken see in the dark? Crazy question. Okay, so we talk about this night vision. Yes, we all can see in the dark because we have this pigment that can actually capture the light. In a very dim light situation, we can capture the light. But some people they lack certain vitamins. They cannot see clearly. You see here, normal visions like that, you can see the road, you can cycle in the dark. But people with a deficiency in certain vitamins, in our case vitamin A, I'm trying to explain in the most simple way the roles of vitamin A in vision. So people with deficiency, problem with having enough vitamin A, they have night blindness. They can't really see in the dark. They have issue. Yeah. So to understand all this, you have to understand our physiology of the eye. This is the whole eyeball here. As you can see, deep inside the eye, somewhere behind the retina, somewhere here behind the light coming here, you see the yellow arrows. That's the light. So there are two kind of cells. That's what they call photo receptor cells. So these photoreceptor cells, rod and cone. Yeah. So the rod is the one work best in low light. The rod is the one that work in dim light situation. The cone, somewhere there, can perceive color in bright light and offer fine image detail. So when you see something fine, something with lots of color, that is due to the cone cell absorbing the light. But when we are in the dim light situation, like in the nighttime without the light, we are relying on the rod cell. So back to the question, chickens, can they see in the dark? The answer is chicken cannot see in the dark. They do not have these rod cells. Okay, so that's about the night blindness. Those days people were the medical profession, they were discussing what causes the night blindness. Okay, cataract can be one of the cause, diabetes can be one of the cause, maybe nearsightedness. And the most famous, the most reasonable explanation given was vitamin A deficiency. Of course, zinc deficiency, because zinc work with vitamin A. There can also be genetic disorder, but most of the time, people were using vitamin A deficiency as the main reason for night blindness. So, certain parts of the world is actually a very serious problem. You go to India, for instance, the many children actually have deficiency of vitamin A. They cannot really see in the dark. That's amazing. Yeah. Okay, so well, those days, actually thousands of years ago, people were relying on this ox liver. Well, ox or bullock is basically what we call male cow. So the liver of the cow was used as a treatment for vitamin A deficiency. But look, long 1500 BC, a very long time ago in the Egyptian time, So they were recommending roasted ox liver, pressed and applied topical to the eye. Can you imagine that? To put ox liver to your eye topically, not by diet. Yeah? And then a Syrian medical text about 700 BC explained it was caused by rays of the moon and cured by application of liver to the eye. Okay, so they did not put the liver itself in the eye, but used the extracted oil, and probably well, they probably enjoyed eating the liver itself. So there are actually many history about this. I don't know whether they are truly true. I'm not sure. But it was the Greek that shifted the recommendation from topical application to frank eating to eating. So they ate raw beef liver soaked in honey to be taken once or twice daily by mouth. So they know that by eating the liver, you can solve the night blindness. That means they know there is something in the liver. They know, but of course they don't really know that it is actually vitamin A. Actually, the discovery of vitamin A occurred around 1912 to 1914 by scientists Alma McCollum and Margaret Davis. Yeah, and then this is a proceeding of National Academy of Science USA 1958, explaining the deficiency of vitamin A and the relation to the night blindness. Yeah, so but actually if you really look at the history after this, there are going to be more discovery. Thomas Osborne and Lafayette Mendel discovered that butter contained fat soluble vitamin A. Yeah, 1913. And then right after that, 1947, we started to synthesize vitamin A. So now we don't have to rely exactly on the liver, on butter. Children in the third world countries, India for instance, they use this synthetic vitamin A for the to resolve the night blindness, I think. So you have to check whether this is true. Okay, so vitamin A settled. That's the first vitamin we introduced. Second, you're going to see the sheep. Okay, for you guys, sheep is known as beriberi, as Malay for sheep. So we call, I don't know why they call beriberi, but it started somewhere in Java. Yes. We are now talking about the vitamin B1 or thiamine. Long time ago, 1630s, a Dutch physician, if you read Indonesian history, the Java history, the Batavia history, there are a lot of things to do with the Dutch. Yeah, 1630s, Dutch physician Jacobus Bonitus observed in Java a very troublesome affliction called by the inhabitants beriberi, which means sheep. So this is why I used the sheep just now. In our language, sheep is beriberi, but in Indonesia, in Java, it's called beriberi. So from this same disease, with their knees shaking and legs raised up, so they describe that people with this problem, having deficiency of vitamin B1, walk like sheep. I do not know how the sheep walk. I can't even imagine. So apparently these people have problem of deficiency of vitamin B1. And if you see the picture of a rice canal here, this is the part of endosperm containing the starch that we eat as rice. That small part there, the bran, apparently the vitamin B1 is concentrated in this region of the bran. Of course, people those days they did not know, so they do rice polishing, and because of that, the bran was removed and vitamin B was removed. So Batavia experiment by Christian Eichmann in 1897 publishes results in a German journal, and for this he was later awarded 1929 Nobel Prize in Medicine in conjunction with the gentleman down there, Frederick Hopkins. Hopkins demonstrated the need for thiamines in the diet publication done from 1906 to 1912 and was co-recipient of the 1929 Nobel Prize with Christian Ekman. Okay, in 1936, thiamine was finally identified and created synthetically. Again, we can create vitamin B1 synthetically. We can produce it in the labs. And commercial production started in 1937, achieved great importance in 1950s. And the demand went up, and we even use not only as a vitamin supplement, also in the fortification of food. Okay, so this gentleman here, Christian Ekman, is the guy that discovered the cause of beriberi disease. He was born in August 11, 1858, a very long time ago. Actually, he accidentally discovered that chicken fat on polished rice exhibited symptoms of beriberi. Well, he observed the chicken. When the chicken was fed with the unpolished rice, the symptom disappeared. So he had this idea, wow, that means something to do with the rice. So this experiment, if he from many experiments later, the finding was that if you feed the chicken with unpolished rice, the bran was still there, the vitamin B1 is still there. The chicken did not suffer from the beriberi symptom anymore. So we learn from this that beriberi is caused by deficiency on vitamin B1 or thiamine, and that led to weight loss, irregular heart rate, weakness, and pain in limbs, making them walk like sheep, or beriberi they call it. Okay, so rice polishing, as we learned today, kills nutrients. Brown rice is better for you. It has a lots of manganese, phosphorus, B3, and there 80% of B1, B6, and fiber, and EFA, which is fatty acids. So the moment the moment they change from brown rice to white rice, the problem started to happen, because those days people ate a lot of rice and less of something else. Nowadays, of course, even though we are consuming white rice, this problem is no longer an issue, because we've been eating rice, but we also eat other stuff with vitamin B1. Okay, next vitamin. Before I go, I want you to answer this question. A condition that connective tissue breaks down and fats are not absorbed, causing easy bruising, hair loss, and anemia. You can't properly absorb iron. So what kind of vitamin deficiency? So you have the idea, yes, it's vitamin C. So vitamin C has something to do with this experiment by a ship doctor, James Lind. He is actually a Scottish, not an Englishman. Those days in 1600 to 1800, lots of sailors in the numbers of about 1 million killed at sea. And James Lind prescribed lemon juice to prevent this. He actually performed experiment to prove that lemon juice actually protects sailors from scurvy. Okay, and there is whole lots of history. I'm not sure how accurate this is. 1601, James Lancaster recorded lemon juice as protective against scurvy. He recorded, but he didn't really understand it. 1744, British Admiral George Anson complete trip around the world. Half of the 2,000 sailors died from scurvy, and only in 1747 that Lind experiment started on this Her Majesty Salisbury, and in 1754 he published Treatise of the Scurvy, the first publication. 1775 Captain James Cook completed historic voyages. Sailors remained free from scurvy, and 1795 British Navy supplied daily ration of lime or lemon juice. And 1932 Walk and King, which is University of Pittsburgh, and Zen Yok Yi from Hungary isolated and synthesized vitamin C, 1932. So that was a long time ago, and we are still using vitamin C in the synthetic form today as vitamin C supplement, and vitamin C also being used to fortify certain food product like orange juice and other stuff. Yeah. So vitamin C was rediscovered and identified by Norwegian researchers Hoyes and Froelich in 1912. And also 1935, vitamin C became the first vitamin to be artificially synthesized. We'll talk about this. Okay, and this is the list of vitamins that was discovered in the year of discovery, 1909. Vitamin A, that's actually could be 1912, like vitamin B1 and vitamin C around 1912. Yeah. These are the source of discovery. You don't have to know the details. You will learn more in the nutrition class. Okay. Finally, when you come back next week Thursday, we're going to into this. We're going to leave history of food technology. We are going to leave history of nutrition or vitamins. We're going to into this. So you have to guess what is this. You have to fill the blank here. What is we are trying to say here, so you have to guess. Okay, so it's about 17 minutes now. I have to stop because I don't want it to be too long. So enjoy your weekend, and you can study this video anytime you like. Take care, guys. Take care. Bye. Happy learning.